Tadi sudah habis. Baik, bismillahirrahmanirrahim. Bapak dan Ibu hadirin yang kami hormati, marilah kita memulai kegiatan webinar series kedua kita hari ini. Assalamualaikum warahmatullahi wabarakatuh. Selamat pagi, salam sejahtera bagi kita semua. Om Swastiastu, Namo Buddhaya, salam kebajikan. Yang terhormat, Ibu Leni Elvira, selaku General Manager International Test Center. Yang terhormat, Bapak Dr. Hari Fadilah, selaku Ketua Umum Dewan Pengurus Pusat Persatuan Perawat Nasional Indonesia. Yang terhormat, Miss Christine L. Sommers, selaku narasumber utama pada webinar series pagi hari ini. Yang kami hormati, panitia penyelenggara kegiatan webinar series, dan juga seluruh peserta kegiatan webinar series kedua kita hari ini. Puji dan syukur kita panjatkan kehadirat Allah Subhanahu wa Ta'ala, karena berkat rahmat dan karunia-Nya, kita bisa berkumpul dan melaksanakan kegiatan webinar series kita hari ini. Kami mengucapkan selamat datang kepada Bapak dan Ibu peserta yang telah meluangkan waktunya untuk mengikuti kegiatan webinar series kedua, kolaborasi antara International Test Center dengan Persatuan Perawat Nasional Indonesia, bertemakan Global Readiness for Indonesian Nurses, Bridging Cultural and Clinical Differences, pada hari ini, Sabtu 6 September 2025. Baik Bapak dan Ibu hadirin sekalian, untuk kelancaran acara hari ini, marilah kita bersama-sama mengucapkan lafal basmalah. Bismillahirrahmanirrahim. Ya, baik. Sebelumnya, izinkan saya memperkenalkan diri. Saya Citra Intan yang akan memandu acara webinar series kedua kita pada hari ini. Sebelum saya memaparkan susunan acara webinar series, saya akan membacakan peraturan dalam mengikuti kegiatan webinar series kali ini. Yang pertama, peserta diharapkan memasuki ruang 10 menit sebelum dimulainya kegiatan. Kedua, peserta diharapkan menggunakan nama lengkap sesuai dengan yang tertera pada akun LMS masing-masing. Ketiga, peserta diharapkan mematikan mikrofon atau mute selama kegiatan webinar berlangsung dan dipersilakan membuka mikrofon ketika sesi diskusi dan tanya jawab. Keempat, seluruh peserta diharapkan mengaktifkan kamera dan menggunakan virtual background yang sudah disediakan selama kegiatan webinar series. Kelima, peserta diperkenalkan bertanya melalui fitur chat selama sesi penyampaian materi oleh narasumber. Keenam, pada sesi tanya-jawab, peserta diperbolehkan menggunakan raise hand jika ingin bertanya secara langsung. Ketujuh, peserta diharapkan mengisi formulir kehadiran yang akan diberikan oleh panitia penyelenggara pada saat sedang berlangsungnya kegiatan webinar series. Baik, selanjutnya, saya akan menyampaikan susunan acara pada hari ini. Baik, acara yang pertama yaitu pembukaan dengan menyanyikan lagu Indonesia Raya dan Mars PPNI, dilanjutkan dengan penyampaian sambutan oleh Bapak Ketua Umum DPP PPNI. Acara selanjutnya adalah penyampaian materi oleh narasumber kita, yaitu Miss Christine L. Sommers. Kemudian acara akan dilanjutkan dengan sesi diskusi dan tanya-jawab, beserta penyampaian kesimpulan. Dan acara terakhir yaitu penutupan dengan menyanyikan lagu himne perawat, serta foto bersama. Baik, Bapak dan Ibu, tanpa berlama-lama, marilah kita menginjak pada acara pertama, yaitu pembukaan, dengan menyanyikan lagu Indonesia Raya dan Mars PPNI. Kepada Bapak dan Ibu hadirin sekalian, dimohon untuk duduk dengan hikmat.
nasional Indonesia, wujud ikatan profesi perawatan, tempat membina dan mengembangkan kemampuan diri dalam membuktikan keberadaannya. Menapaklah dengan keyakinan lebih pasti, sejajar dalam abdikan diri, bangkit berdiri dan langkahkan kakimu itu, menatap hari esok penuh asa. Wahai perawat Indonesia, bangkitlah dan majulah untuk menolong sekalian yang menderita. Kuatkanlah pribadimu, tingkatkan pengetahuan untuk memberikan asuhan keperawatan. Kita melangkah untuk mengisi pembangunan bangsa negara Indonesia, untuk menghantarkan bangsa menuju sehat semua dengan semangat jiwa Pancasila. Maju perawat, majulah dalam kancah pembangunan, tunjukkanlah pada sekalian orang. Jadilah perawat model kesehatan bangsa kita, jadilah teladan dalam hidup sehat. Bangkitlah perawat seluruh Indonesia dalam mengemban citra profesi, menjunjung tinggi kode etik keperawatan, laksanakan panggilan tugas mulia, mencapai derajat kesehatan seoptimal mungkin bagi warga negara Indonesia. Sebagai bukti kiprahnya mahkota putih suci dalam mendukung pembangunan kesehatan, dengan organisasi PPNI yang kokoh, padu bersatu serta selaras, perawat Indonesia akan mampu angkat citranya di mata insan dunia.
Baik, terima kasih Bapak dan Ibu peserta sekalian. Acara selanjutnya adalah penyampaian sambutan sekaligus pembuka acara webinar series yang akan disampaikan oleh Bapak Dr. Hari Fadilah, Sarjana Keperawatan, Sarjana Hukum, Magister Keperawatan, Magister Hukum. Kepada Bapak Dr. Hari Fadilah, kami persilakan.
Baik, Assalamualaikum warahmatullahi wabarakatuh. Selamat pagi dan salam sejahtera bagi kita semua. Om Swastiastu, salam, namo buddhaya, salam kebajikan. Yang tentu saya hormati teman-teman pengurus DPP PPNI dan juga Ibu Leni dari ITC bersama tim. Terima kasih Bu. Yang tentu ini yang kedua seminar kita yang kita laksanakan ya, untuk tentu memberikan insight dan informasi kepada perawat-perawat kita di dalam menghadapi kancah global hari ini. Juga kepada khususnya kepada special for speaker from United States, Christine ya. We would like to welcome and thank you to Christine who has agreed to be speaker in this seminar. We hope that we all get your valuable insight and your experience to us. Okay. Dan juga kepada teman-teman semua yang menjadi peserta seminar pada hari ini. Dan saya pikir seminar hari ini sangat penting ya dan relevan dengan kondisi hari ini di mana batas-batas antar negara itu semakin tipis, pendayagunaan sumber-sumber di antar negara itu juga semakin mudah dan memberikan peluang yang besar berpindahnya sumber-sumber tersebut, termasuk sumber daya manusia seperti kita perawat ini. Dan juga apalagi Indonesia atau pemerintah Indonesia punya target-target tertentu di dalam mengisi pasar-pasar kerja dunia yang harus diisi oleh perawat-perawat Indonesia. Nah, untuk itu tentu kita harus bisa juga memahami berbagai aspek ya. Apa yang disampaikan Christine nanti adalah terkait dengan bagaimana kesiapan secara global kita untuk menghadapi kondisi yang hari ini kita di depan mata ya, dari aspek bagaimana kita bisa mengetahui aspek kultur dan berbagai kebijakan-kebijakan dan aspek-aspek klinis mungkin berbeda dari satu negara dengan negara yang lain ya. Dan hari ini kita mendapatkan insight dari Christine. Mudah-mudahan kita bisa memahami dan sebagai bekal kita untuk paling tidak kalau ada yang mau keluar ya, luar negeri maksudnya bekerja di luar negeri, ini paling tidak menjadi bahan yang berharga. Atau yang di dalam negeri juga kita bukan tidak mungkin di masa yang akan datang kita juga bisa menerima klien-klien atau pasien-pasien kita, atau bahkan ada rumah sakit-rumah sakit yang akan berdiri di Indonesia. Jadi saya kira ini cukup positif buat teman-teman. Ayo terus kita ikuti serial-serial yang akan dilakukan oleh ITC bersama PPNI ya, dalam rangka meningkatkan pemahaman dan sekaligus nanti kalau saya harap sih pesertanya ini ada peserta yang loyal gitu ya. Kami juga bisa minta apa namanya, nanti panitia mohon dimintakan nomor handphone supaya ada informasi-informasi yang lebih lanjut bisa kita sampaikan ya melalui komunikasi ini ya. Saya kira itu yang bisa saya sampaikan. Saya buka acara ini dengan mengucapkan basmalah dengan ketukan 5 kali Pancasila. Ya. Terima kasih. Semoga bermanfaat dan sukses selalu. Terima kasih Bu Leni.
Terima kasih Pak Haris.
Ya. Terima kasih kepada Bapak Dr. Hari Fadila yang telah menyampaikan sambutan sekaligus membuka acara webinar series pada hari ini. Baik Bapak dan Ibu peserta webinar series Global Readiness for Indonesian Nurses, Bridging Cultural and Clinical Differences, untuk acara selanjutnya yaitu pemaparan materi oleh narasumber kita yang dilanjutkan dengan sesi diskusi dan tanya jawab. Sesi narasumber hingga sesi tanya jawab akan dipimpin oleh moderator kita yaitu Ibu Leni Elvira. Kepada Ibu Leni Elvira selaku moderator waktu dan room Zoom kami persilakan.
Oke, siap. Sekali lagi terima kasih, maaf saya nggak sengaja unmute. Selamat pagi Bapak Ibu sekalian. Again, thank you for the Saturday morning. Good morning everyone. Welcome to webinar series 2, Global Readiness for Nurses, for Indonesian Nurses, Bridging Cultural and Clinical Differences. My name is Leni Elvira from International Trust Center, and I'll be your moderator for today's session. Apabila Bapak Ibu, ini adalah pertama kali Bapak Ibu rekan-rekan mengikuti webinar kolaborasi antara ITC dan PPNI, selamat datang. Untuk rekan-rekan nakes, ada juga dokter ini yang saya lihat dari absensinya, ataupun perawat, mahasiswa, dosen, saya mewakili ITC dan juga PPNI mengucapkan selamat bertemu daring. Terima kasih hadir kembali untuk yang sudah ikut di sesi pertama dan yang kedua hari ini juga ikut begitu. Kami senang teman-teman perawat, calon perawat, mahasiswa, tenaga medis, dan kesehatan lainnya boleh ikut hadir untuk sesi pagi hari ini. This event is organized by International Trust Center in collaboration with Persatuan Perawat Nasional Indonesia, PPNI, and we're so glad to see many of you joining Saturday morning because last time you asked for Saturday or Sunday session, so here we are. So today we will explore how Indonesian nurses can prepare themselves to become globally ready by understanding cultural and clinical differences in nursing practices. And we're going to highlight the United States because we are representing through merit from the United States, and our speaker this morning, Christine, is here with us to share. allow me to introduce our distinguished speaker, Christine L. Sommers. We can call her Christine or Christy. She's the Director of Nursing at Corban University, Salem, Oregon, USA. Kalau sesi yang lalu, rekan-rekan, ada nurse Indonesia dari negara bagian yang lain. Sekarang she's from Corban University, Salem, Oregon, USA. Kita akan lihat map supaya nanti kelihatan ya. And she also serves as Director of Nursing International Placement at UPH, Universitas Pelita Harapan, Jakarta, Tangerang ya. With over 25 years of teaching experience in nursing and a Ph.D. in nursing. So, Bapak Ibu rekan-rekan bisa lihat ada Ph.D, RN adalah registered nurse, dan CNE adalah certified nurse educators ya. Christine has dedicated her career to advancing nursing education and preparing nurses for global opportunities. Jadi beliau di Amerika juga di Indonesia, di Jakarta, UPH. She's going to share. We are truly honored to have you here with us, Christine. And because we're talking about a topic that is very close to our heart for many Indonesian nurses, we are highly skilled, I believe, but stepping into international practices requires readiness. That's why we're talking about clinical knowledge and how to adapt. To make the session more interactive, just like we did in webinar series 1, we'll run this session with Q&A style discussion with our speaker. But before we dive into the questions, I would like to invite Christine to introduce herself. Kalau tadi saya sudah sebutkan siapa, Christine akan share sedikit about herself. Where is she now? And if we have like several questions, we can come to her also. Okay. Christine, please. We would like to hear from you about what you are doing.
Okay, selamat pagi. And so let's move to the next slide. And so just a little bit of background about me. Go back one.
Okay.
Yep. I grew up actually in the state of Alaska, and I earned my Bachelor's of Science in Nursing in the state of Ohio. After I graduated from nursing, I went back to Alaska and worked as a nurse up there for a year. And then I moved to Washington State to get my master's degree. And then I worked in Washington State teaching and also working in ICU for several years until 2010 when I moved overseas. And then recently in June of this year, my family and I moved back to the United States, and I'm now teaching nursing, as was mentioned, in the state of Oregon. And so I've been a nurse for over 35 years, and I have taught in the academic and practice settings for decades. And the reason why I showed you this slide is so that you can see how large the United States is, and kind of also to actually see where the state of Alaska actually is. If you go to the next slide, on this slide, you can see better the names of the different states, but Alaska and Hawaii are not in their correct geographical location. So you can see that I used to live in Washington State, and then now I'm just south of that in Oregon State. And so moving to the next slide. And so here, it just kind of shows both the United States and Indonesia, because both countries are quite large, especially as you look at it from east to west. And I just also want you to recognize, I said I was from Washington State, which is over here on the West Coast. And that is frequently confused with Washington, D.C., which is on the East Coast. And so the difference between Washington State and Washington, D.C. or Washington District of Columbus would be going from about north central Sumatra all the way to West Papua. So it is actually quite a distance away. And so I know when I lived in Indonesia, many were not aware of how large the United States is. And so if we go to the next slide, and here comes the pictures. I've had the opportunity to be involved in nursing and nursing education throughout Southeast Asia. I've had the opportunity to be able to teach nursing in the Philippines as well as in Bangladesh. And in 2010, my family and I moved to Bangladesh, where I worked there in a clinic for 2 years. And then on the next slide, in 2012, we then moved to Indonesia, and for the last 13 years, I had the opportunity to teach nursing at Universitas Pelita Harapan from 2012 to 2025. And I worked with an amazing group of educators to train hundreds of nursing students each year. And then also recently, in about the last 3 years, we worked hard to be able to develop an international track where we do have Indonesian nursing students that are learning nursing, but predominantly in English. And so continuing on to the next slide.
Yeah.
I'm very excited about nursing education, and with my experience of teaching in both the United States and in Indonesia, I have a unique perspective to share with you about bridging cultural and clinical differences between the two countries. Two things have happened to increase the global opportunities for Indonesian nurses. One is because of the global COVID pandemic, there is now a global nursing shortage. And I can honestly say this is the worst nursing shortage I have ever seen. And there is not any near end in sight. Countries are wanting qualified nurses. The other thing that has happened is 2 years ago, the Minister of Health there in Indonesia publicly declared that there is an excess of nurses in Indonesia. And so because of that, many countries are now looking to Indonesia seeking qualified nurses. And so moving on to the next slide. Let's begin to explore some of the differences between the US and Indonesia.
Yeah.
And so,
sorry, Kristen, just
Yeah.
before we go to this pointers about the content. Bapak, Ibu, again, if you have questions, Bapak Ibu kalau ada pertanyaan boleh ditulis di kolom chat. Nanti kita juga akan buka sesi tanya jawab begitu ya. Nanti boleh raise hand ataupun open mikrofonnya dan bisa tanyakan langsung. So we have pointers Kristen will deliver. It will be so much better if you have the questions ready in English, but don't worry if you have the questions easier for you to say it, to type it in Bahasa Indonesia. I will help you to communicate with Kristen. But before Kristen, do you speak Indonesian just like a little bit?
Sedikit.
Sedikit. Okay.
Yes.
Okay then. So let's just continue with the differences perhaps of the nurses and nursing.
Yep. And so as we move to the next slide, one of those areas that we see those differences is in cultural competence and communication. And so, like Indonesia, there are many different cultures in the United States. And so it's going to be important to be respectful and honoring of the different cultures. There's also going to be differences in communication styles, and it is important to know how to best handle those conflicts and advocate for patients. So let's discuss each one of these. And so as we think of the first one here, cultural competence, it's vital for effective nursing care, especially for Indonesian nurses working in the US. It's going to be important to respect patients' cultural values and their communication styles in order to be able to enhance trust and the care quality. As nurses, we need to develop skills to navigate these cultural differences. For example, some patients will want family to be very involved in their care, and others will not want any family involvement at all or allow any information about their condition to be released to families. And so, according to the 4 C's of culture by Slavin et al., there are some questions that you can ask to find out what is it the patient preferences as it relates to culture. And so you can ask them, what do you call the problem or condition? What do you think caused the problem or condition? How do you cope with your condition? And then what are your concerns about the conditions or the treatment? And that's going to help you learn what it is that they are wanting for their patient-centered care. The next thing to take a look at is enhancing nurse-doctor interactions for healthy work environments. And so the nurse-doctor interactions do significantly impact patient care quality and staff morale. As you can see on the next slide, the American Association of Critical Care Nurses, or AACN, advocates for healthy work environments that promote collaboration, trust, and respect among healthcare professionals. Similarly, the American Nurses Association, or ANA, highlights the importance of safety, meaningful recognition, and supportive leadership, emphasizing the shared decision-making and effective conflict resolution enhances both patient outcomes and workplace satisfaction. One of the things that you may have heard about is that in the United States, the communication style is more assertive, or some would even call it blunt. And so assertive communication is essential for effective nurse-doctor collaboration. And this will also promote that trust and that clarity. It encourages nurses to express concerns and suggestions confidently, facilitating better patient outcomes. In contrast, in Indonesia, we tended to use more of an indirect communication, depending upon subtle cues. And sometimes that can cause misunderstandings in countries that use assertive or more blunt communication styles. So an example would be a nurse confidently and assertively letting a physician know that the patient's high blood pressure is continuing and to have a conversation about perhaps the medication should be changed. I know as we have worked with sending students and graduates overseas, one of the things that our Indonesian students have commented was that the physicians are actually looking to them to give a summary of what is happening with the patient and is actually asking for their advice as they think about together a team, what is going to be the most effective patient care for that patient. Another thing to think about is how to handle conflict and how to be able to be an advocate for the patient. Learning conflict resolution techniques and advocating skills is really going to help you provide that respectful and equitable care. Cultural sensitivity training is going to support being able to navigate these challenges constructively. And then that effective conflict resolution will be important to be able to have those professional relationships and clear communication with the physicians and also the healthcare providers and the patient and family. And it's going to involve listening and empathy. As a nurse, you really need to be an advocate for the patient. You will need to help make sure that the patient's rights and needs are prioritized. At times, that's going to mean speaking up for the patient's best interests, but you need to make sure that you understand their wishes and their concerns. An example is a nurse noticing a patient's pain is not being adequately managed and then communicating that to the healthcare team to ensure that the patient receives appropriate pain relief. Now let's switch and talk a little bit more about professional ethics and decision making. Some of those things are going to be related to ethical dilemmas, informed consent, and the Health Insurance Portability and Accountability Act, otherwise known as HIPAA. So the first thing to look at is ethical dilemmas. As a nurse in the US, you may encounter ethical dilemmas. And remember that cultural differences are going to influence the decision making. One example might be patient autonomy versus family wishes, especially toward the end of a patient's life. There will also be ethical dilemmas to balance care quality as well as resource limits. And an example of that could be related to organ donation, as well as the availability of blood products for transfusion. Many hospitals do have an ethics committee to assist with complex dilemmas. Another area that is important is related to informed consent. There's going to be a strong emphasis on individual autonomy and legal documentation. It's going to be important that the patient, if they're able to make decisions, that they are the ones who are understanding what is happening to them, and they will need to provide informed consent for themselves. Translation devices and certified medical translators are used to bridge language barriers, ensuring accurate communication and understanding between healthcare providers and patients. And if there is a translation barrier, then on any legal document, such as informed consent for a surgery, you need to make sure that you have either a certified medical translator or a certified translation device to assist with the translation. It cannot be a family member. Then the final area in this part is related to confidentiality and patient privacy. HIPAA is a key U.S. regulation protecting patient privacy. Nurses are responsible for safeguarding health information, both in paper form and electronically. Adhering to HIPAA promotes the trust and protects healthcare institutions from a variety of legal risks. Patients expect confidentiality. If you breach patient confidentiality, or you look at a medical record for a patient that's not assigned to your care, you can be fired. And in fact, at the hospitals that have electronic health records, their IT will actually track who is opening up different records. And if they end up with a famous patient, then they will look to see if anyone opens that chart that does not belong. And then those people will get fired. I cannot stress enough how important patient privacy and confidentiality is in the United States. And this is an area that is very different in Indonesia, where we frequently share a variety of different things with each other. And it's kind of expected that there's some sharing. But in the United States, confidentiality and patient privacy is a big deal. Now let's take a look at some expectations in clinical practice, such as those regarding nurse-patient ratios, digital systems or electronic health records, and then documentation in the United States. And so that first area is related to nurse-patient ratio standards. Having an effective nurse-patient ratio is important to ensure safe and effective care. Research has shown that better ratios reduce patient mortality and nurse stress. Regulations are going to be different region by region. That is going to impact how hospitals allocate nursing staff. And California, in their regulations related to nursing care, they actually define what the nurse-patient ratio needs to be. In other states, it is different. It's also going to depend on the nursing model of care, whether they are using primary nursing, where one nurse is providing all of the care for 4 to 6 patients, or if they're using team nursing, and where you might have a medication nurse, an admitting nurse, and kind of divide the work up that way. They're also going to be looking at models that are looking at the acuity of the patient, because you could have really sick patients that are going to require more time from the nurse, as well as patients that may not be as sick. Other things to be looking at that are related to how many admissions are there going to be, how many discharges, because each of those tends to be more time consuming. And so being able to have proper staffing support for that workload management is going to improve overall care quality. The next area we'll take a look at is digital systems in nursing care. So electronic health records enable nurses to document care efficiently and to reduce errors. One of the things that's different in the United States is that there will be an electronic health record that is integrated. It won't be several different apps. Everything is going to be integrated into one system. Nursing documentation is a key component of the electronic health record. Not only do physicians and other healthcare providers read the nursing documentation, but patients also can have access to their charts, including that nursing documentation. And so nurses understanding what is required for documentation is very important, and making sure that things are documented in real time to be able to assist in timely interventions. Nurses require training to adapt to these electronic health record systems. So again, ensuring that patient data privacy, and then also that seamless workflow integration. And the electronic health records also are an important part of interdisciplinary communication and being able to help improve care coordination. The next area to talk about is related to Joint Commission and documentation requirements. And so I would like to attempt to be a little bit interactive here. And so if you could use the raise hand feature, I believe it is here. Where is raise hand? Or you can just give a heart. How many of you work in a hospital that is certified by Joint Commission International? Okay, so I'm seeing some raised hands. Great. So that's great. Some of you are familiar with Joint Commission. Joint Commission on Accreditation of Healthcare Organizations, or JCAHO, is different and is more rigorous than Joint Commission International. They play a key role in maintaining healthcare quality by setting those rigorous standards. Proper documentation is key to being successful with Joint Commission accreditation and their surveys, because it not only supports patient care, but it also protects the healthcare providers legally. That documentation needs to be comprehensive, timely, and also reflect adherence to protocols, including infection control and medication management. This again helps to ensure that continuity of care and safety in those clinical settings. The documentation is a lot. It's important to do the documentation because if something was not documented, it wasn't done. And that can also influence billing and payment, resulting in loss of payment for care. So, for example, when I was still working in the ICU, one of the things that we needed to make sure that we did was inspect the skin of any new admission. And if there was anything on the skin that looked like it might be a breakdown or a pressure ulcer, we had to take a picture and document it in the chart within the first 24 hours. If we did not, and a pressure ulcer developed, then we could not bill insurance or Medicare. The hospital would have to cover the cost. And so we would lose money on that. And so documentation is key. And a lot of that documentation is part of the nurse's responsibility. And so it is very important to document the excellent care that you are providing. Some of the questions that I get asked about nursing in Indonesia are related to advanced practice roles that are in the United States. And so now we're going to switch to briefly discussing about some of those advanced practice roles. And again, if you would like more information about these different roles, please make sure that you drop a question in the chat. And then I know a lot of what you want to talk about is how do you navigate US licensure and certification? And then I'll also talk a bit about the importance of creating an international nursing portfolio. And so some of the more common advanced practice roles is a nurse practitioner. Nurse practitioners go on and get advanced training. Now it is expected to be a practice doctorate, otherwise known as a DNP, and they can provide primary as well as specialty care. When I was working in the ICU, we had acute care nurse practitioners that were working along with the intensivists. In the emergency department, you can have nurse practitioners that are working alongside the physicians. You also have nurse practitioners that, depending upon the state that they're practicing in, can actually practice independently and not be associated with a physician and have their own clinic. But it does require an advanced degree, and at this point, it is a doctorate of nursing practice. Another specialty area is a certified registered nurse anesthetist. This again has gone to an advanced degree and requiring a practice doctorate. CRNAs are able to administer anesthesia safely. I do know that in Indonesia, there are nurses who are trained on the job to be able to provide anesthesia in certain surgical cases. But in the United States, that requires that you go on and you not only get the doctorate, but then you would need to sit for a specific board exam related to that specialty, whether it is for CRNA, an acute care nurse practitioner, family nurse practitioner, orthopedic nurse practitioner. All of those have specific exams that you would need to sit for after you completed your degree and pass before you could practice to that advanced level. A clinical nurse specialist is frequently working in the hospital and is really focusing on improving patient outcomes through expertise, as well as for providing professional development to the nurses in that particular ward, and even sometimes also to physicians and other healthcare providers. I really enjoyed at one point being able to work as a clinical nurse specialist in an intensive care unit. That also requires a master's degree or higher. And again, being able to take an exam that is showing that you have documented expertise in that particular area. And so these are some examples of advanced practice roles that are available in the United States that are a little bit different than roles that are available in Indonesia. All right, so now the interesting information of what many of you are wanting to get specific information. And that is about how do you navigate US licensure and certification. One of the key pieces to this is going to be English proficiency. And I want you to think back on that slide that was shown of all of the different states. So counting Washington, D.C., there are 51 different boards of nursing in the United States. So there is not a PPNI that governs the entire country. there is a board of nursing for each state, and each board of nursing sets their own standards for what is required to be licensed as a nurse in that state. So not every state requires English proficiency, but English proficiency is required to be able to get a visa. And so roughly, it is getting a TOEIC score of around 725 to 750, which is approximately about an IELTS of 6.5 to 7. And so English proficiency is a must, not only so that you can communicate with patients and their families and other healthcare providers, but so that you can understand how English is used when you sit for the NCLEX exam. And so every nurse must pass the NCLEX exam in English. That's one of the requirements in every state. It is the same exam for every state, and the criteria for passing the NCLEX exam is the same for every state. All of the states are going to require that there's an evaluation of your transcripts and credentials. And one of the companies that has expertise in evaluating those credentials is TrueMerit. So I've included their website. You can also go on their website and look at which state you are considering practicing nursing, and it will give you additional information. Does that state require English proficiency? TrueMerit provides 2 different types of reports for evaluating credentials, and you go on the website and it'll tell you which state requires what report. Another key link that is helpful for our information is the NCBSN Internationally Educated Nurses page. This also provides very helpful information on preparing for the NCLEX and looking at the process for being able to sit for the NCLEX exam and applying to state boards of nursing. Another thing to look at is internationally educated nurses may use the ISPN credential for eligibility. And TrueMerit just recently is using that ISPN as a global nurse certification to help validate that, yes, you are prepared and are able to practice nursing globally, and that can assist in going through the process of being able to sit for the NCLEX exam. The NCLEX exam is very different than the UCM exam. The UCM exam is not only is it giving you the multiple choice questions, but part of whether you pass or fail the UCM exam is your GPA. For the NCLEX, it's all questions, and it is adaptive questions. So it's going to look at, did you get the last question correct, yes or no? And then it will give you a different question based on how you responded to the previous question. And so it is imperative that you study for the NCLEX. There are a number of different companies that you can use to help prepare for the NCLEX, as well as NCLEX study guides, but it is going to be very important. It's also, when you prepare for the NCLEX, it's going to help you become more aware of what are some of the standards and scope of practice of nursing and expectations of nurses in the United States. So part of this process is submitting to a state board of nursing to receive authorization to test, otherwise known as an ATT for the NCLEX exam. And then you are eligible to then register with Pearson VUE to be able to sit for the NCLEX exam. The closest centers for sitting for the NCLEX are Manila, Hong Kong, and Taipei. It would be wonderful if we have enough interest that we could convince Pearson VUE to start offering the NCLEX in Jakarta. So then after you get the license, it's going to be important that you maintain licensure through continuing education and meeting state requirements. Another part of going through the State Board of Nursing is more and more the state boards of nursing are requiring a background check that requires fingerprints. And so it's going to be important to reach out to that board of nursing on how can you do that when you are still in Indonesia, or can that be finished after you sit for the NCLEX and you arrive in the United States? So this is only talking about US licensure and passing NCLEX. There's another part of coming to the US that is related to getting a visa. And that is another process that also needs to be navigated. And that's where that visa screen is so important, as well as working with the Ministry of Migration and making sure that there is a valid job order. One of the things that it is important, and the government of Indonesia is watching closely, is for nurses to actually, from Indonesia, to go to other countries and practice as a nurse, and not as a caregiver, that they're actually practicing to the full extent of what you have been trained to do. And so that's another process related to the visa screen and the job order process. Okay. That NCLEX exam is going to really be focusing not only on your knowledge, but also on clinical judgment and decision making. And it has some very interesting different ways to ask questions, and different ways that they ask questions related to a case study. And so again, that's going to be very important to do some of the practice materials for NCLEX. And in fact, I would recommend that you either purchase with a company preparing you for the NCLEX, or some of the international travel agencies that are looking for nurses to come to the United States. If you are accepted by them, then they will help you to prepare for the NCLEX, because it is a very different exam than the UKAM and most of the exams and testing that we have done there in Indonesia. So then kind of the third piece on this section is creating that international nursing portfolio. And so that's going to be consolidating all your credentials, including education, licensure, and clinical experience. And it's going to be important that you get certified English translations of all of your educational transcripts, your licenses, and certifications. And that can be put into the portfolio. You want to build your CV to include your clinical experience, and then also to summarize your not only your experience, but also your professional references. And then that portfolio will help you as you go through that true merit report process to evaluate your educational credentials. And so I do know that ITC is able to assist and has a process for developing an international nursing portfolio. And so, as I've given kind of this brief overview of some of the differences, you can begin to see that there are some differences between the nursing roles, and the scope of practice are going to be different between Indonesia and the United States. One of the things to also remember is that scope of practice will also vary slightly between the different boards of nursing. And so it's going to be important that you look at your state where you want to work, that you look at the regulations for that particular board of nursing. And then again, the expectation is going to be on clinical decision-making skills and clinical judgment, especially when implementing what is called standing orders. I have rarely seen standing orders being written by physicians in Indonesia, but it is very common in the United States. And in fact, you may have multiple sets of standing orders. And so an example of some of these orders might be 500 to 1,000 milligrams of acetaminophen, which is the generic name for paracetamol. And you're to give that every 4 to 6 hours as needed for pain. Do not exceed 4 grams in a day. And so it'll be your responsibility to determine, are you going to give 500? Are you going to give 1,000? How often are you going to give it? And so you'll need to be working with the patient, assessing their level of pain, assessing what is effective and what is not effective with this pain management strategy. And then if it's not working, communicating that to the physician so that you can find other ways to help the patient with their pain. And so that's just one example of the need to have the clinical decision-making skills and clinical judgments as it relates to standing orders. So then I get asked this next one a lot is, what are some of the trends? You know, I mentioned that because of the pandemic, there is now a global nursing shortage. There's been a lot written about the nursing shortage. There's a lot of information about which countries are needing nurses and where. How do we make sure that we're protecting countries so that there is not a brain drain? How does all of that come together? And so I'm just briefly going to give a little bit about what some of these trends are, because I can assure you that 5 years from now, the United States is still going to need nurses. And so this next slide is what are some of the projected nursing shortages 5 years from now. And so again, remember, each state board of nursing has different requirements for being a registered nurse in that state. You also hear about what is called the compact nursing states. And so over 40 states out of the 51 are part of the compact nursing state. And so what that means is if you have a license in one state, you're eligible to work in other compact nursing states. However, getting that initial licensure in a state varies even among the compact states. And so on the list above of the 7 states to have large nursing shortages in 2030, Alaska and California are not compact nursing states. And so you can see California is going to have a deficit of 11.5%. California has some of the most interesting regulations for being licensed in their state. And so it's very important to follow what they have. Many of the states require additional education before you can be licensed. So for example, here in Oregon, where I am currently practicing, I had to document that I had completed some professional development of 1 hour in pain management and that I had had 2 hours of cultural competence. Other states, Texas is another one that is requesting some additional education or professional development that needs to be completed before you can receive a licensure in that state. So I am seeing that there are lots of questions that have been asked. And so I think next is the questions that were submitted ahead of time, and then we can look at going through some of the questions that are in the chat.
Yes. Okay. Just checking, Christine, sorry, is the buzzing sound, can everyone also hear that? I'm afraid that it's from your end, perhaps. You sound all right, but I've been hearing that buzzing sound along with your voice.
It
Just
may
making
be
sure.
the fan that I have going on in the background because it's very warm here in Oregon and no air conditioning.
All right. So anyway, what time is it now at your end now in Oregon?
Oh, it's 8:30. We've only got plenty of time. We still have another hour. Yeah.
Okay. All right then. Okay. Okay. So it's kind of hot for now, the weather outside.
Yeah, surprisingly hot. It doesn't usually get this hot in Oregon, but that's okay. I'm adapting.
Okay. Just checking if it's all right with you. All right then. So that's all the the sharing that Kristen has been giving us. I think that we're going to continue to answer several questions from the participants who have registered. We have perhaps more questions, but we will go with the questions first that you have submitted. We sorted questions. Let's just go with the second two so that Christine can share her knowledge, thoughts related to this. This is from Teresia Rahma Natali, a student from Stikes Notokusumo, Jogja. How can nursing schools in Indonesia help nursing students become better prepared for global career? The other one, so this is talking about perhaps you being a lecturer. From Nurse Rosa Galika Gita Gracia, the sekolahnya tidak di-mention ya. Anyway, how can nursing faculty in Indonesia adapt the curriculum to align more with global standards, particularly in terms of cultural competence and clinical practice? Christine, yes.
So some of the areas to look at, again, one area is English proficiency. Is it possible to assist our Indonesian nursing students to be more proficient in English so that they can build on that proficiency as they go through the S1 and the Professi program? Looking at clinical judgment and decision-making, another area that tends to be lacking when compared to the United States curriculum is in the sciences. In the United States, there are about 20 hours, depending upon which state, of science curriculum. One of those is microbiology, and I don't know any nursing program in Indonesia that has a standalone microbiology class, in addition to having some general chemistry, as well as anatomy and physiology. So part of that would be the sciences. And I think also as we think about adapting the curriculum, it's going to be utilizing active teaching strategies, looking at case-based scenarios, as well as using role play and simulation. Another thing to think about as it relates to clinical practice is, can there be more clinical practice in the S1 rather than only in the Professi program? Because it's going to be important that they have more interactions with patients. And again, not only could that be at the hospital, but that could also be in simulation centers and skills labs. And so providing cultural competence is also going to be important. Like I mentioned, here in Oregon, that has to be part of the S1 curriculum. If you're an experienced nurse coming into Oregon, then you're going to need to demonstrate, or you're going to need to take 2 hours of cultural competence training before you'll get a license. And so I think having that be more obvious in the S1 curriculum will be important, whether not necessarily a standalone class, but making sure that it's included as part of course descriptions, and that there's a real emphasis throughout a variety of the different courses focusing on cultural competence. And I think, one of the beauties of Indonesia is there's over 700 different people groups. And so there is a wide range of cultures of patients to care for in Indonesia. And so there's many opportunities to be able to build on building that cultural competence.
Okay. All right. Before we go to the next questions from the pre-events, I wonder if we're talking about the United States, there are 50 states, say, different board of nursings.
Yep.
If we're talking about the curriculum of what to teach, how and so on, in the nursing schools, are there also different in making those
Yes.
hours and
Yes.
so on?
Okay. So each board of nursing is going to have different requirements on what is included as part of the nursing curriculum. Again, in the United States, you usually have to complete 1.5 to 2 years of what they call prerequisites. And so that's usually your general education classes, as well as your science classes. And that is true whether you're going to get an associate degree in nursing or a bachelor's degree in nursing. And the boards of nursing are very different in what they require for those prereqs, and also even what they require for the actual nursing content.
Okay, noted. Thank you. Okay, let's go to the next questions before we go to the chats, and everyone maybe have more questions. From Ratu Citra Pitaloka, student, Institut Kesehatan Deli Husada Deli Tua, I believe is somewhere in Sumatra. How has your experience as a lecturer? So the student is asking, teaching in international nursing education. How do you feel teaching Indonesian nursing students, perhaps comparing to the American students? And the other one, this is from Dr. Grace. Are there opportunities for nursing graduates from UPH? So this is part of when you were in UPH University to work abroad. Do you have this kind of program?
Yeah. So I am very passionate about teaching nursing, regardless of where I am. I really enjoy teaching nursing and helping to prepare the next generation of nurses. And so I delighted in being able to teach in Indonesia and make a difference to Indonesian healthcare. I would say there's many similarities between Indonesian nursing students and US students. You've got some students that study hard and others that don't. Others that really struggle and they don't quite make it. It's true on both sides of the Pacific Ocean. And so, so I'm happy to teach both. And I think, one of the other things is we think about the opportunities to be able to collaborate with institutions in the United States to have more Indonesian nurses here, is having those collaborations between universities and being able to look at how can we do semester abroad, as well as having American students come to Indonesia and experience what Indonesian and what Indonesian healthcare looks like. I think there's a lot of opportunities for that. And I think that would improve nursing care in both countries. As far as opportunities for nursing graduates from UPH to work abroad, we've had some of our graduates go to a variety of different countries. We're actively sending our graduates to the Netherlands. They have to learn Dutch first, so that's a bit interesting. We've had some others in the past who've gone to Singapore during the pandemic, not so much anymore. And then we've had some conversations about possibility for Hong Kong, because Hong Kong changed some of their regulations for allowing foreign nurses to come. And then we are actively working to send some of our graduates here to the United States.
Okay. Next sorted questions. Bapak Ibu, kita tidak bisa bacain semua, jadi kita kategorikan sedikit begitu dan pilih beberapa pertanyaan. Tetapi pertanyaan Bapak Ibu kita sudah simpan dan sortir, yang nantinya kemudian kita bisa bantu jawab setelah sesi ya. Jadi kita kumpulkan dulu begitu. These next questions still from the sorted questions of pre-events. Ainil Radia, nurse from RSAU. How can nursing care be improved in the global era when serving foreign patients or international tourists? I believe when you were in Indonesia, you were perhaps a patient for once or twice. And then Kansa from Poltekkes Kemenkes Surabaya. What non-medical soft skills are most essential for Indonesian nurses to succeed? And the other one is Diana from Muhammadiyah Jogja. What's the biggest challenge experienced by Indonesian nurses first time they work in hospitals abroad in the United States? As you mentioned that you quite often sending the students and then work in the hospitals. How do you see, if we're talking about Indonesian nurses first time they work? Yeah.
So I think when we think about nursing care, serving foreign patients or international tourists, there are thousands of international tourists there in Indonesia. And for many of them, even if they're from Europe, they do have some conversational English. And so think about, learning conversational English so that you can at least chat with them, ask them about their pain, find out if they're hungry. Do they need to get up and go to the toilet? Learning some of those basic phrases in English. And I can tell you, when I've been in a patient, it can be frightening, especially if nobody talks to you. And so many of those international tourists, they're not expecting perfect English, but they will be very grateful if you can say a few phrases to them that will let them know that, yes, they are being cared for and they can communicate some basic needs. The next one's related to non-medical soft skills, essential for Indonesian nurses to succeed on the global stage. I would have to say it's going to be assertive in communication. You need to speak up. The physicians and other healthcare members, they are humans as well. They make mistakes. And we are all part of a team and we all need to work together. And so if you're seeing an order that doesn't make sense, or you can't read the handwriting, or the patient's allergic to a medicine and it got ordered anyways, you need to speak up. And so I think learning how to be more assertive in communication, again, you're still respectful. You can still be kind when you do that. And so learning how to be assertive and speak up is going to be really important. Biggest challenges experienced by Indonesians, first time that they work abroad. Again, I think when I was talking with some of our graduates that were working in the Netherlands, they were surprised at how much the physicians were asking them for input in managing patient care. And the expectation that, they had important information to share. I think the other piece is going to be related to documentation. Others are expecting the nurses to document, and that documentation is a key part of the electronic health record.
Okay. So thank you. Before we go to the open questions for the participants, perhaps some of you would like to raise hands. Can I anyway, Christine, you feel as a non-Indonesian, do you feel this is something like cultural that we tend to shy away, let's say, to conversations when it comes to,
And, I'll be honest, that's true for Southeast Asia as well. When I've worked with Filipino nurses that have come here to the United States, I've had them when I was teaching nursing here in the US, I've had them as students, and they're also very polite and kind. And when I had them in clinical, and it's like, no, you need to call the doctor. No, I can't call the doctor. Yes, you're going to call the doctor. I'm going to be right here for you. So again, I think, it's just a difference. And so it's a skill that needs to happen. When I was there in Indonesia, I needed to learn to be, to adapt and, communicate that way rather than being as assertive and blunt as I would be here in the US. So I think it's important to recognize where you are and appropriately adapt to the conditions so that you can provide the best healthcare possible for your patients, depending upon what country you're in.
Okay, Southeast Asian.
Yeah.
So we're going to open several questions from the participants. I saw some of you raise hand. Ada yang mau tanya langsung mungkin? Okay, so let's give the opportunity to Christine, Sonia, Tafu, yeah? Okay, please, Christine, you may open the mic and introduce yourself a bit, whether you are a student, nurse, or where you are, please.
Okay, thank you for chance that have been given to me. Currently, I'm working as a nurse in Silwam MRCCC in Jakarta Selatan, and I'm graduate from Universitas Pelita Harapan also. It is very nice to meet you, Ibu Christine.
Yeah.
So you mentioned about some kind of different area in the US. Maybe is there any recommendation for our Indonesian nurse to work in the US. Maybe you mentioned about some kind of place that have a few nurses, or maybe some kind of a place that have many nurses. Maybe is there any region area in the US maybe you will recommend it for us to working in the US? Maybe that the best on the environment around us that could help us as a new nurse to adapt easily as a newcomers. And aside from the US, is there any other countries that maybe you will think that will be good for us as an Indonesian nurse to working overseas? Yeah.
Okay. So there's lots of opportunities. One of them I mentioned was Hong Kong, and you can get on and go to the Hong Kong Board of Nursing website, and there you will see the information related to the requirements to work in Hong Kong. For the United States, I think, the country's huge. There's thousands of hospitals. Just like in Indonesia, some are great hospitals, some are not so great hospitals. There's no way you're going to know that information just by looking at websites. And so I think it's going to be really important that you work with someone to help you navigate that, whether that is an international travel agency, of which there are several. I'm not sure if there's any that True Merit has had experience working with, or ITC. Because you're going to need help navigating all of this. Or, some of your other UPAHA friends, they're now working in the US. You can contact them and get their recommendations. What are the needs at their hospital? And is there possibilities for you to be able to get a job at their hospital? So you need to work with someone, whether it's a friend, whether it is with ITC, if it's with an international travel agency, or contacting your faculty at UPAHA. You need to work with someone to help you navigate the process.
Okay, thank you, Christine. And Christine, double Christine, for the question, and also both from UPH. Before we go to the chat to read the questions, are there more questions from the audiences so that you can deliver the question yourself? Ada lagi, Bapak Ibu? Okay. So we have Nespi Syabania. Nespi Syabania, perawat. Silakan, Nespi.
Saya oke ya, Bu.
Oke.
Yang saya tanyakan itu adalah, kan kalau misalnya kita mau, maaf pakai bahasa Indonesia nggak apa-apa ya. Kalau misalnya kita mau ke US itu kan berarti kan harus pakai kualifikasi RN kan ya. Nah, terus persiapan apa aja yang mesti kita siapin, kayak misalnya dokumen apa aja sih yang mau kita siapin untuk jadi RN itu. Nah, terus kualifikasinya seperti apa. Dan terus kita kalau misalnya dapat informasinya itu dari mana sih? Karena kan kalau di Indonesia itu cuma pakai nurse aja sama MD. Ya, kalau misalnya RN kan berarti kan ada kompetensi khusus lagi kan, gitu. Nah, terus RN itu hanya berlaku di US atau di negara lain? Terima kasih.
Okay. Terima kasih, Nespi. Nespi asked the several questions technical related to NCLEX. I wonder if you can catch several of her messages, Christine.
No, it was a little fast.
Okay. So first is NCLEX is something related. This is like UKNI in Indonesia, right? So her question is like how are, this is something related to the documents, requirements, and so on.
Right.
The second is it acceptable somewhere else if we're not talking about states in the United States? Do you have any idea whether that says passing that and then having that title registered nurse can be used to other countries, let's say?
Yeah, okay. No, the NCLEX for the United States registered nurse only works in the United States. Canada also offers an NCLEX, but you would still need to apply to become a nurse in Canada, even if you have passed NCLEX in the United States. So even for example, I was a registered nurse. I was never recognized as a registered nurse in Indonesia, even though I passed NCLEX and am a registered nurse. I think you also need to remember the NCLEX is very different than the UCAM exam. How they present the case studies and the vignettes is different than how UCAM does it. And so you will need to invest in resources to help you study and prepare for the NCLEX because it is very different than UCAM.
Okay, thank you. I hope that answer, Nespi. To the rest, rekan-rekan, mungkin saya akan sampaikan dalam bahasa Indonesia. I would like to add several things related to NCLEX. Kalau menjadi perawat di Indonesia, Bapak Ibu, kan kita perlu pass UKOM, UKNI ya. Itu kan sebenarnya adalah lisensi, begitu. Kalau di Amerika Serikat, tesnya adalah NCLEX. Jadi itu seperti UKOM-nya, harus lulus. Kemudian itu adalah lisensi, begitu. Cara daftarnya ada linknya sebenarnya, karena itu udah dari nursing board di 50 states dimanapun, nanti tesnya sama sebenarnya, maksudnya tes NCLEX-nya. Mendaftar ada requirement-nya tentu saja, pasti dicek dokumen dulu apakah kamu perawat. Saya kan bukan perawat ya, udah pasti saya nggak bisa ikut tesnya begitu. Jadi ada dokumen untuk dicek dulu. Karena itu kalau dari True Merit, kami mewakili True Merit, ada yang namanya Credential Evaluation Service. Jadi dicek dulu, karena kita kan orang asing mau ikut tes, daftar dan segala macamnya online ya. Kemudian dicek dokumen, nurse atau bukan, kemudian lisensi dan segala macam dari negaranya. Semuanya diupload, ada dokumen. Kemudian setelah itu yang perlu juga ada seperti kursus untuk dilakukannya dulu. Jadi ada yang perlu diambil kursusnya, lalu coba harus belajar karena dia berbeda Bapak Ibu dari UKOM. Jadi perlu belajar sih begitu. Jadi ada course-nya yang perlu diambil lalu ikut tes. Tesnya sendiri anggap saja seperti kita mendaftar tes atau beli ujian online atau beli tiket nonton bioskop atau pesawat. Sebenarnya bisa daftar lalu nanti pilih jadwal dan segala macam. Yang diperlukan adalah karena tes centernya tidak ada di Indonesia, jadi Bapak Ibu kalau mau ikut tesnya nih, si lisensi itu, paling dekat setahu saya ada di Malaysia, Hong Kong misalnya, Filipina, Taiwan, atau tentu saja di Amerika Serikat. Jadi untuk ikut tesnya harus ke sana. Begitu. Karena itu kita berbicara juga mengenai mungkin yang diperlukan juga adalah karena kita adalah orang asing, dokumen-dokumen disiapkan dan bisa dari jalur visa screen dan segala macam. Itu yang nanti kita bisa share sedikit ya. Dan secara teknis rekan-rekan bisa tanya kepada ITC begitu, kepada kontak narahubung ya untuk terkait dengan si teknis begitu. Dan yang kedua digunakannya di Amerika Serikat registered nurse itu Bapak Ibu. Tapi kan kita biasa bahwa teknologi, advancement, dan segala macam dari sana. Jadi sehingga seringnya itu dijadikan landasan. RN-nya nanti, walaupun misalnya sudah RN di Amerika Serikat, tapi mau bekerja ke Kanada, bisa digunakan, tapi tetap seperti melamar-melamar begitu. Sama seperti kita bekerja ya, kalau misalnya punya pengalaman, sudah pass tes internasional, biasanya akan dimudahkan, tetapi lain negara pasti punya tesnya masing-masing. Kurang lebih begitu, semoga menjawab dari pertanyaan ini dan kenapa kita buat arahnya, karena kami mewakili True Merit di Amerika Serikat begitu di sini, dan biasanya kalau aksesnya kalau ke sana sudah baik nih Bapak Ibu, akan mempermudah untuk standar-standar lain dari negara-negara lain. Kurang lebih begitu ya, semoga menjawab. Okay, so thank you Christine for waiting. If we have, I think we're going to give another person if you would like to
sure.
ask from using your own microphone. Ada pertanyaan Bapak Ibu, atau kita bisa ambil dua pertanyaan dari chat. Ada yang mau tanya lagi? Raise hand. Bahasa Indonesia oke atau oke? Kalau belum ada, saya akan ambil. I'm going to pick several questions, 2 or 3 from the chat.
Okay.
One is from Idalia Goretti Silva Suarez. Kebijakan apa yang paling efektif? Policy. This is something about policy. The most effective for balancing nurse workload with the quality of patient care. I think this is something related to the clinical. I heard, Christine, that workload or your task as a nurse will be divided even in several things instead of in the Southeast Asia, even in Japan. The previous speaker said that when she was in Japan, she handled quite many checklists, several things. But in the United States, she also mentioned one is doing this, the other one doing this, and this. So they coordinate and so on, because the patient is the what's so important, and so on. Yeah. So the question is actually how to make it most effective, balancing nurse workload with the quality of patient care.
So I think quality of patient care is important because there's going to be ratings related to the quality of care that is given, and a lot of metrics have to be supported and submitted to Joint Commission. How that is done is left up to the hospitals. And so it's going to vary by region to region and hospital to hospital. And so I can't give you one specific one because it's going to depend on the nurse, and things that they're going to look at is the acuity of the patients in the area. What is the nursing skill mix? How many bachelor's prepared nurses do they have? How many associate degree nurses, which would be more like a diploma nurse? And then also here in the United States, there's another level of nursing called a licensed practical nurse or a licensed vocational nurse. And so as well as then having healthcare assistants. And so not every hospital has all those different levels. And so they're going to make that decision based on what's going to work best for them. One of the things you do have is, you've got respiratory therapists, you have physical therapists, sometimes occupational therapy, dietitian. All of those are also helping to provide overall care to the patient. And so the nurse isn't necessarily having to do everything because there are some other healthcare providers that assist.
Okay, thank you. Hope that answers. When it comes to the policy, I think it's the something how we handle things based on the hospitals, perhaps. Okay. The next is this is something related to, I think, a case, let's say, is raised when someone how are neglected patients without ID or family members handled in terms of nursing care. Perhaps someone is not having her or his ID, going to the hospital, going to the emergency room, perhaps, and they don't have the contacts and so on. What happened here? Maybe that Ina Kusbandia would like to know how
So
that kind of thing happened in the
patient that we
hospitals.
don't know who they are, right?
Yes,
There's no ID.
yes.
Okay, that happens.
Yeah, what about the nursing care costs and so on? Yeah.
So you cannot refuse a patient based on their ability to pay. They show up in the emergency department, you have to provide care. You cannot send them to another place. You can't send them out the door. You have to provide care. And so it is going to depend on, do you eventually find out who this patient is? Sometimes that happens. You get the police involved and they help to find out who the patient is. But yes, maybe they are a patient and they have no insurance. And so then the hospital is going to work with that patient or their family to come up with a payment plan, or many hospitals also have a financial aid program related to charity care to work with to try and come up with what is possible. But you cannot refuse care based on whether someone has insurance or not. And if they show up in your emergency department, you have to treat them.
Okay. Even though that there is no identification of that person.
Yeah. So
okay.
20 years ago, I was taking care of a 18, well, we found out later he was 18. He had been involved in a drug bust that went wrong, and he had been shot in the head. And so he is comatose. No identification. We have him there in the ICU. He is intubated. We are giving IV fluids. We are treating him. It doesn't matter. You cannot deviate your care based on what their insurance is.
Okay.
Then that
Thank
is
you.
also very different than Indonesia. I had a hard time with that when I first got there.
Thank you for answering that, Christine, to confirm. Bapak Ibu perhaps have different experiences here. Anyway, let's go to the next question. How from Rahmatika Chandra Satriani, how can healthcare organizations ensure the documentation remains accurate and timely without increasing the administrative burden on nurses?
It does increase the administrative burden. There's no way around it because you have to do it. You have to finish it before you go home. And that's why it's important to have training on how do you utilize these electronic health records. One of the things that has recently been coming out from one of the largest electronic healthcare record providers is called Epic. They released about their plan over the next couple of years to really integrate AI in the hopes that maybe AI could actually be used to help decrease the administrative burden. But again, you would still have to double check it because AI hallucinates. But yeah, it takes time to document, and you have to do it. It's not optional. It has to be done.
Okay. Okay, then the last question, I guess, because due to the time limitation, what steps from Teresia Rahima Natali, what steps should young nurses take to continuously improve their competencies in line with their latest development in nursing science and healthcare for the young nurses? Perhaps you can give thoughts or motivation, I guess.
So I think read. See what's happening in the nursing world. Read your nursing journals. There are some great national journals as well as international journals there in Indonesia. So read those, be involved, be active in your hospital or unit. And then if you feel that you do have a calling to go to another country, then be really proactive in finding out what are the requirements, because they're different for every country.
Okay. Yes. I hope that also answers. Technically, I think this is the last just for the statement. Your material is very interesting. This is from Kusila Devia Rahayu. Is it sufficient for Indonesian nurses who have graduated from abroad and wish to work in the United States to be ISBN certified without NCLEX? Okay.
You have to take the ISBN, and some states require it, some do not. So you have to, so every state requires NCLEX. Some states require both. Some only require NCLEX. The advantage of taking the ISBN is it will give you an idea of how well prepared you are to take NCLEX, and it is available there in Jakarta. You don't have to travel to another country to take it.
Yes.
But you have to take NCLEX, no exceptions.
Okay, thank you for restating that, Christine. Bapak Ibu, jadi lisensi harus diambil. Dan tes NCLEX itu adalah wajib ya. Jadi dia seperti UKOM, UKNI, harus diambil untuk lisensi dan harus lulus gitu. Nah, bagaimana? Perlu baca, perlu lihat lagi, perlu banyak dengar. Bapak Ibu bisa ke YouTube-nya ITC juga untuk lihat lagi webinar series 1 kemarin, karena kasih tips, triks, motivasi bagaimana terkait dengan NCLEX, ada sharingnya di sana ya. Jadi boleh dicek di YouTube-nya International Test Center. Due to time limitation, again, Bapak Ibu, we won't be taking more questions and answering, tetapi Bapak Ibu rekan-rekan ITC dan PPNI juga speaker, kita menampung dan membaca pertanyaan yang Bapak Ibu berikan. Kami akan sampaikan rekap via email nantinya atau WhatsApp group untuk bisa menjawab pertanyaan dari Bapak Ibu. Okay, again back to Christine. Thank you so much. I think we can go to the closing statement, motivation from you for nurses in Indonesia or the students who, you know, aspire to one day work abroad.
Yeah.
Yes.
So in the 13 years that I was able to spend in Indonesia, I really saw the profession of nursing grow. And so that has been so exciting to see. I have seen the curriculum be strengthened. Apni has worked hard to strengthen the curriculum. And so your expertise as a qualified registered nurse makes you in high demand internationally. Yes, you're probably going to need to learn another language. If you're going to go to the Netherlands, you need to learn Dutch. If you're going to go to the United States, you need to become proficient in English. And so I would encourage you to work on that. And so specifically, since we're talking about the US, be thinking about how can you be prepared to work in the US? How can you take advantage of the opportunities to grow professionally, contribute to patient care, and to be able to make a global impact? And the other thing I want you to think about is the concept of circular migration. In research done among Indonesians is that many of them, after they have worked abroad, they do come back to Indonesia to be with their families and to be able to continue to work. And so I want you to consider that and be thinking about, if you are returning, then how can you be able to share that expertise? If you want to learn more about the concept of circular migration, I was able to write an editorial in Journal Nurse, so I posted the link to that in the chat. But really think about, you have been well trained. You have the opportunity to make a difference in the healthcare in another country like the United States. But then as you return and come back to Indonesia, you have an opportunity to be able to contribute to the healthcare in Indonesia as you're able to share what you have learned with other nurses there in Indonesia.
Okay. Thank you, Christine, for that summary and motivation for others. Again, Bapak Ibu, if you have more questions, barusan juga ada link yang diberikan oleh Christine di chat, silakan dicek untuk tahu lebih banyak begitu ya. And for if you have more questions, Christine is also open for questions from you. You can send it via email or easily contact us from ITC or PPNI related to this. That will be the information and sharing from Christine. I would like to summarize untuk Bapak Ibu apa-apa saja yang kita bisa ambil dari sharing sesi webinar pagi ini dan beberapa technical yang saya kira tadi ada pertanyaan-pertanyaan yang perlu dijawab gitu ya. This is just like a short summary what's all about for today. Bapak Ibu, kita perawat Indonesia sudah memiliki keterampilan klinis yang kuat, namun kesiapan global membutuhkan persiapan lebih ya. We're talking about tes, kemudian documents and so on. Dan tadi di highlight biasanya if we are accepted and work in the United States, if I'm not mistaken, Christine, even we can be granted the green screen and we can come with the families. So we need to consider as well, bisa tinggal di sana dan bagaimana, karena biasanya kita suka pulang kembali begitu, dan pas pulang kembali bagaimana deliver knowledge-nya dengan teman-teman di sini begitu ya. Kemampuan beradaptasi dengan budaya dan komunikasi yang efektif, jadi asertif tadi adalah kunci sukses praktek perawatan internasional. profesionalisme, etika, dan patient-centered care perlu menjadi fokus untuk memenuhi standar global. Persiapan sejak dini untuk uji kompetensi internasional, karena tadi lisensi misalnya, NCLEX, Christine mention ISPN, which is now namanya adalah Certified Global Nurse Nursing Qualifying Exam, that is the same, yang bisa membantu dari sisi lain kalau misalnya tidak langsung mengambil tes NCLEX begitu, membuka lebih banyak peluang karir di luar negeri. Dan perawat tentu saja diharapkan memiliki semangat belajar berkelanjutan dan wawasan global untuk mengharumkan nama perawat Indonesia di dunia. These are pointers because Bapak Ibu tidak hanya mahasiswa, tapi institusi pendidikan juga ada di sini, dosen yang ikut terdaftar, dan juga perawat-perawat. Tentu saja there are things we need to make sure untuk meningkatkan, karena skillnya sudah baik, kemudian ada tadi cultural dan juga clinical that we need to see how to bridge different countries, would be different ways of doing things, communicate and so on. That is something that we need to understand and to adapt learning. Untuk highlight sekali lagi Bapak Ibu yang sudah disampaikan di sesi webinar 1, if we're talking about going to the United States, we're talking about license, this is a must because hukum NCLEX-nya perlu diambil begitu. Dan kita mau informasi juga ada jalur yang sifatnya karena kita orang asing masuk ke negara orang, ada dokumen-dokumen yang perlu dipenuhi ya begitu. Ikut tes NCLEX ke tes di negara penyelenggara, tadi saya mention ada Malaysia, Hong Kong, Filipina begitu, kemudian ada di Taiwan misalnya yang dekat, ataupun ke Amerika Serikat. Lulus NCLEX berarti Bapak Ibu akan mendapatkan registered nurse title. Ini yang bisa menjadi pintu dan ini adalah wajib kalau di Amerika Serikat. Kemudian ada juga kalau kita tidak berbicara mengenai langsung ikut tes dan pergi ke negaranya. Di sini kita ada highlight, Bapak Ibu bisa juga ambil langkah untuk visa screen, program dari True Merit, di mana programnya yang tadinya disebut sebagai ASPN, tetapi sekarang adalah Nursing Qualifying Exam, nanti title-nya adalah Certified Global Nurse. Apa sih keuntungannya? Karena ini bisa diambil di Indonesia, tidak harus ke negara tujuan tadi, dan untuk ini memang karena tadi proses kerja ya Bapak Ibu ya, perlu ada proficiency tes bahasa Inggris begitu. Karena itu ini adalah hal yang kita highlight di ITC dan kita bisa support untuk Bapak Ibu perawat khususnya begitu. Dan membutuhkan untuk screening ini ada 2 dokumen. Untuk Certified Global Nurse ini ada Nurse Qualifying Exam yang dirancang sebenarnya mirip-mirip dengan NCLEX, cuma NCLEX tesnya adaptif tadi Bapak Ibu. Tergantung dari pertanyaan apa, jawabnya betul atau salah, lalu next question-nya akan berbeda-beda. Kalau nurse qualifying exam ini adalah sudah fix gitu ya, tapi punya test items, ada bank data dan seterusnya. For that, saya juga seperti sesi sebelumnya, bahwa kita memberikan apresiasi kepada peserta webinar yang absensi dan LMS nanti disampaikan. Mohon maaf saya belum cek dari chat Bapak Ibu yang mengisi absensi dan hadir di webinar kali ini dan sudah memenuhi di LMS dari Ministry of Health, kita memberikan apresiasi berupa tes TOEIC yang pendaftarannya kita akan sampaikan nanti sampai dengan 12 September minggu depan untuk pendaftaran online from home. Jadwalnya nanti akan diberikan untuk dipilih dari available time-nya Bapak Ibu begitu ya. Jadwal tesnya nanti sebelum 4 Oktober yang paling lama. Jadi tesnya dilakukan bulan ini. Please take this opportunity Bapak Ibu supaya bisa ukur dulu apakah secara bahasa saya cukup dan bisa melihat lebih lanjut begitu. Untuk nursing qualifying exam kita akan jadwalkan di bulan Maret 2025 begitu. Informasi-informasi ini kita akan kirimkan detailnya via email kepada peserta, Bapak Ibu. Jadi jangan lupa untuk mengisi feedback dan absensi. Kemudian juga untuk nanti di-approve, dicek di LMS, kurang lebih seperti itu. Dan apabila ada pertanyaan, kita ada WhatsApp group, ada teman-teman narahubung di sana yang tersebut di dalam flyer untuk Bapak Ibu bisa hubungi ya, kurang lebih seperti itu. That would be all from me. Christine, thank you so much for the time that you are here with us sharing. Again, we will be in touch with you, and we hope that we will have more opportunities going forward, and probably opportunities from any nurses here in Indonesia to one day maybe to Oregon and then meeting you somewhere. Yeah, thank you so much. And I will end this session and pass this back to MC. Kepada MC, saya kembalikan. Terima kasih.
Baik, terima kasih kepada Ibu Leni Elvira yang telah memoderatori sesi penyampaian narasumber, diskusi dan juga tanya jawab dengan luar biasa. Terima kasih juga kepada narasumber kita. Thank you, Christine, as our distinguished speaker, who presented such outstanding material so that the enthusiastic participants here in this webinar series were motivated to become even more prepared for their careers as nurses abroad. We hope that what we have learned from this webinar series will be useful for our future progress, especially for Indonesian nurses who want to have career in the US. Baik, Bapak dan Ibu, alhamdulillah kita telah sampai pada acara terakhir, yaitu penutupan. Untuk menutup acara webinar series hari ini, marilah kita bersama-sama mendengarkan lagu Himne Perawat. Kepada Bapak dan Ibu peserta dimohon untuk duduk dengan hikmat.
Perawat Indonesia, emban tugas mulia, mendampingi segenap insan untuk meningkatkan kesehatan, kembangkan terus profesi, tingkatkan terus potensi, profesional dan rendah hati, siap melayani dan berbakti. Membangun negeri tercinta, sehat sejahtera bangsaku, siang malam sepanjang waktu, langkahmu selalu ditunggu. Tak membedakan umat, semua dilayani dengan cinta tulus dan dedikasi. Kau bawa talenta suci.
Baik, terima kasih Bapak dan Ibu peserta sekalian. Dengan dikumandangkannya lagu Himne Perawat, maka selesailah rangkaian acara webinar series Global Readiness for Indonesian Nurses, Bridging Cultural and Clinical Differences hari ini. Saya selaku pembawa acara memohon maaf apabila terdapat salah kata dan perilaku. Terima kasih dan wassalamualaikum warahmatullahi wabarakatuh. Bapak dan Ibu masih diperkenankan untuk hadir di room Zoom ini karena kita akan melakukan sesi dokumentasi. Seluruh peserta dan juga panitia penyelenggara dimohon untuk membuka kamera Zoom-nya untuk berfoto. Baik, ada 19 slides, saya akan coba bantu pandu. Untuk slide yang pertama, for the first slide. One, two, three. Oke. Untuk slide yang kedua, 1, 2, 3. Slide ketiga, 1, 2, 3. Slide keempat, 1, 2, 3. Slide kelima, 1, 2, 3. Slide keenam, 1, 2. Slide ketujuh, 1, 2, 3. Slide ke-8, 1, 2, 3. Slide ke-9, 1, 2, 3. Slide ke-10, 1, 2, 3. 11, 1, 2, 3. Lanjut, slide 12, 1, 2, 3. Slide 13, 1, 2, 3. Slide 14, 1, 2, 3. Slide 15, 1, 2, 3. Slide 16, 1, 2, 3. Slide 17, 1, 2, 3. Dan slide terakhir, 1. Ya, baik Bapak dan Ibu, sudah semua terdokumentasi. Terima kasih untuk peserta webinar dan juga panitia untuk dipersilakan meninggalkan ruang Zoom.
Terima kasih panitia dan
Terima
narasumber.
kasih, Ibu.
Terima kasih Bapak Ibu, selamat siang.
Terima kasih Bapak Ibu, selamat siang.
Terima kasih.
Terima
Thank
kasih.
you, Christine. Good
Ya,
evening to
Terima
you.
kasih.
Bye, everyone.
Ya,
Terima
bye-bye. Sampai jumpa.
Terima kasih, Kak.
Terima kasih, Kak.
Terima kasih Kak.
Terima kasih, Kak.
Terima kasih, Kak.